Hello everyone, and welcome to OMC Medical Reno webinar. Today, we have an incredibly insightful video lined up for you. We'll be diving into a topic that holds immense significance, not just for the United Kingdom, but for the entire world, the advantages of the UK market, with a special spotlight on the NHS, the National Health Service. Now, whether you're an investor, a healthcare enthusiast, or simply curious about global markets, this video is bound to provide you with a fresh perspective on the strengths and unique features that set the UK market apart. But before we jump in, you can view this video in OMC Medical YouTube channel, and don't forget to hit that subscribe button and ring the notification bell so you never miss out on our in-depth explorations of various markets and industries. Alright, let's get started. At OMC Medical, our mission is crystal clear. We're here to support our clients in launching their products in various markets, all while handling the complex procedures and providing them with an effective regulatory strategy. Our motto is breaking barriers for complex markets. A quick note on the solutions we provide: compliance, license management, representation, market support, translation, and strategy. We've got it all covered. At OMC Medical, we're here to make your journey smoother than ever. As an ISO 13485 and ISO 17100 certified service provider ready to partner with you. Yes, we do not call ourselves consultants, but your partners, putting your needs first and compliance above all else. With our global presence with strategically placed offices and wider partner network, OMC can help you with various regions and support you with registration services across various markets. Now let's dive into our topic today. Why regulate medical devices? Medical devices play a critical role in the healthcare industry, from simple bandages to complex surgical instruments. However, without proper regulation, these devices can pose serious risks to patients. Unregulated devices may not meet safety standards or undergo proper testing, which could lead to malfunctions, injuries, and even death. By regulating medical devices, we can ensure that they are safe and effective for patient use and hold economic operators accountable for any issues that arise. The UK's medical device regulatory framework serves the dual purpose of assuring patient safety and encouraging innovation. It employs a risk-based approach, with higher-risk devices subjected to more stringent regulations. The framework encompasses critical components such as device classification, conformity assessments, pre-market approval, post-market surveillance, clinical investigations, and guidelines for non-UK manufacturers' market access. These components collectively ensure the safety and efficacy of medical devices for patients' benefit. Brexit has had a significant impact on the regulation of medical devices in both the UK and EU. Prior to Brexit, medical device regulation was governed by the EU's Medical Devices Directive, MDD, and the In Vitro Diagnostic Devices Directive, IVDD. However, with the UK's departure from the EU, these regulations no longer apply in the UK. Instead, the UK has implemented its own regulatory framework, the UK Conformity Assessed (UKCA) mark, which will apply to medical devices sold in the UK. The UKCA mark will have similar requirements to the MDR, but there may be some differences that manufacturers will need to be aware of. One potential benefit of the UKCA mark is that it could allow for faster approval times for medical devices in the UK, as the UK will not be bound by the EU's approval process. Encompasses clinical investigation, conformity assessments, and post-market surveillance. UK is home to 500,000 medical technologies, from simple bandages to innovative technologies and digital healthcare products, serving in hospitals and community care settings and home. As the wider population in UK is getting older, more and more care homes, assisted living projects are everywhere in UK. To make the access to our elderly, both the UK government and NHS are supporting technologies that support remote monitoring and digital healthcare systems that can help with quicker diagnosis and treatment of patients, as NHS serves several million people on any given day, which causes strain on the NHS system of NHS. In UK, the medical device classification is still maintained as per EU Medical Device Directive, with slight amendment, bringing classification of MDR. Medical devices are classified into Class 1, further sub-classified into 1S, 1M, 1R, 2A, and 2B, and 3. UKCA marking is a new product marking for goods in Great Britain, England, Wales, Scotland, and replaces CE marking for most goods that needed it previously. The EN standard has been replaced by an equivalent, BS, British standards, for most products. For medical devices, you have to additionally adhere to NHS's DCB standards. CE marking remains valid in Great Britain for most product categories, and has the new transition timelines presented by EU. UK also adopted the timeline with its own validity dates, most of which ends on the 30th of June 2030 for medical device products. Here is the detailed timeline for MDD and MDR products based on their classification. As you can see, MDD certified products are still allowed into UK market Unit L, the 30th of June 2028. And MDR product are valid until the 30th of June 2030. Same process is applied for IVD products too. The UK has a strong focus on innovation, dating back to the 1800s when it was known for its industrial superiority. Today, the country continues to prioritize innovation to support critical care industries and meet the everyday needs of various communities. To help manufacturers ease the strain on critical care, the innovation pathway has been introduced. This pathway, supported by the 1000 HR, NI 100E, and NHS, collectively by England, Wales and Scotland, is known as the Innovative Devices Access Pathway (IDAP). It offers 8 clinical support applications, a quicker route to the UK marketplace, and access to a wide array of development support for these products. This initiative was presented in June this year and has already seen great success, with many applications placed by the October 29, 2023 deadline. The committee members are now evaluating this route, and we can expect to see innovative products launched to market on the quickest routes available anywhere else in the world. The MHRA conducted a public forum meeting in June 2022 and agreed below. Though these are statements they agreed, this may not be completed until Parliament approval. The UK regulation should be filling the gaps left by MDR. This means a new regulation or amendment to UK MDR 2002 will be made. Later, MHR announced that this new regulation draft would be published by the end of 2023, and the full version, upon approval of WHO, will be released in mid-2024. UK may look into other conformity routes, such as MDSAP for quality and FDA-approved market entry devices. The medical technology market in the UK is predicted to reach 1948 billion in 2023 with 3.6% annual growth. The market volume is expected to hit 2325 billion by 2028. The UK has over 30 top medical giants headquarters and most startup companies established here. World's extensive government-run health service, NHS, over 100 research universities are also present in the country. The UK government provides funding, which is one of the largest in the world, nearly £1 billion over the span of 2 years. Each funding starts from £20,000 to £4.5 million. The UK is home to wealthy tycoons, angel investors, and venture capitalists. Diverse pathways, one destination. Choose the UK market for unrivaled access, innovation, and impact. There are many routes to market for manufacturers into the UK market. Through NHS supply chain. Through national tender for procurement. Through direct or indirect sales. The National Health Service (NHS) is the publicly funded healthcare system in the United Kingdom. It was established in 1948 and offers free healthcare to all UK residents, regardless of their financial status. The NHS is organised into 4 main branches: primary care, secondary care, community care, and public health. NHS is one of the world's most extensive government-run health services. This means advantages to manufacturers regarding one single source of patient data, clinical studies, and new product development. NHS Supply Chain is the national procurement partner for the National Health Service (NHS) in England. It provides a range of goods and services to support patient care, including medical equipment, pharmaceuticals, and food supplies. Benefits of becoming an NHS supplier. Becoming an NHS supplier ensures a stable customer base and increased revenue. By entering the NHS market, you access a constant demand for products and services. As a crucial community element, the NHS contributes to national well-being, making your involvement rewarding both financially and morally. Most of our clients ask us how to participate into NHS, and it's great to see that you will also be interested in exploring these opportunities to sell into the NHS. One of the ways to access NHS is through public tenders. It's important to note that government portal tenders are not just limited to medical devices or NHS. The portal shows tenders for various departments and members, including the Ministry of Defence, many well-known universities, and other members and manufacturers in the UK. Most of these tenders require you to have a distributor or some presence in the UK, at least a UKRP, and most can be participated in from abroad. While there are many third-party sites that show government tenders, the best place to access them is directly on government websites. If you need any support or guidance on how to access these tenders, please let us know and we'll be happy to help. We're also planning to showcase some of the major tenders on our website newsletters in the future, so do keep an eye out for that. To become an NHS supplier, businesses must first register with the NHS supply chain. This can be done online through the NHS supply chain website. Once registered, businesses will need to provide information about their products and services, as well as their financial and legal status. After registering, businesses will need to meet certain requirements in order to become an approved NHS supplier. These requirements include meeting quality standards, providing competitive pricing, and demonstrating a commitment to sustainability and ethical practices. Now, let's discuss the benefits for manufacturers. Collaborating with the NHS provides access to a large and established healthcare market for medical devices, technologies, and services. Partnerships with the NHS offer opportunities for research, testing, and validation of products in real-world healthcare settings. Supplying the NHS enhances brand credibility and allows manufacturers to contribute to improved patient care and outcomes. Registration with the NHS provides these companies with increased visibility and credibility, particularly advantageous for smaller or newer firms. The NHS handles a vast amount of patient data, which can be valuable for organizations developing data-driven healthcare solutions. Access to anonymized health data can enable organizations to analyze trends, outcomes, and patient behaviors, leading to the development of more targeted interventions. Clinical studies. The NHS is one of the largest clinical research organizations in the world, with a vast network of hospitals, clinics, and research centers across the UK. These studies are designed to test new treatments, medications, and medical devices, as well as to evaluate their effectiveness of existing ONs. They not only help to advance medical knowledge and improve patient care, but they also provide opportunities for UK manufacturers to develop and market new healthcare products. To conclude, UK, along with NHS, provides you the greatest advantages manufacturers in a single market. Establishing yourself in UK may provide greater advantages, such as access to funding pool, clinical data, and studies. Easier access to European market. UK's infrastructure is liked in most Middle Eastern market. UAE and Saudi are one of the pioneers adapting themselves to the NHS ecosystem. Medical device market in UK is the third largest in Europe. How can OMC support you in this process? OMC can support compliance with UK CR or EU MDR by obtaining certifications for your products. Analyze your product's UK market supply chain demand and provide a market report. Find the correct distributor to increase your market value. OMC can help you with UK market access by acting as your responsible person and supporting you with import clearance activity. OMC can support NHS supplier chain or tendering processes. OMC can support you with worldwide registrations and representations. OMC can support you and your team with training and understanding the new regulations. At our core, trust is paramount. Our track record of success demonstrates our extensive experience and knowledge. We proudly serve over 300 active clients and have achieved remarkable results in registering and accessing markets for them over the past few years. Our clients appreciate our opinions and support in introducing their products to various markets. Recently, we partnered with a Chinese manufacturer to register their products in 12 markets within 9 months. This resulted in a revenue gain of over $6 million for our client. Our extensive work with the global community has equipped us with the necessary knowledge and expertise to support manufacturers in expanding their reach into new markets. During the pandemic, we had the honor of supporting the NHS by providing emergency use devices. Our efforts were recognized by being featured in the NHS 75 Use booklet, which was published and kept in the House of Parliament UK, a historic moment we will cherish forever. Due to our extensive work with the global community, we are working closely with the Department of Trade UK to support foreign manufacturers in bringing their products into the UK and UK manufacturers in expanding abroad. Thanks for joining us.